right. For today's session, we will be looking at gastrointestinal and urologic emergencies, and we'll also be looking at toxicology. Now, with gastrointestinal complications, you need to think about hypovolemic shock, you need to think about infections, you need to think about inflammatory issues and obstruction. When something is wrong with the intestines, you will get excess vomiting, you'll get diarrhea, and you can get an obstructed bowel. These are things you should consider. Let's get straight into it. All right. Abdominal pain is a common complaint. The cause of abdominal pain is often difficult to determine, right? Because of the size of the abdominal cavity. And when we think about the abdominal cavity, we have to think about the peritoneal space, organs that are within the peritoneum, organs that are outside of the peritoneum or retroperitoneal, and we have to think about the organs in the pelvic region. So there's a lot of organs found within that specific area. So it's very difficult to pinpoint what exactly is going on in the field. So we don't play around with abdominal pain when a patient presents with abdominal pain in the field. As an EMT, you do not need to determine the exact cause, right? That might not be possible in the field. You should be able to recognize a life-threatening problem though, right? So you must be able to pick up when there's a life-threatening issue and act accordingly and transport the patient as soon as possible. Let's review the anatomy and physiology. The abdominal cavity contains the gastrointestinal system, genital system, and the urinary system, made up of solid and hollow organs. And at this stage, you should know the difference between your solid and your hollow organs. Solid organs tend to be highly vascular, so they will bleed a lot when injured. Hollow organs have digestive juice within them, so when that spill, it can cause irritation, leading to some form of itis and in general peritonitis. So your solid organs include the liver, the spleen, pancreas, kidneys, ovaries. Injury to a solid organ can cause shock and bleeding. Oops. Hollow organs include the gallbladder, the stomach, small intestine, large intestine, urinary bladder. Breach of a hollow organ causes its content to leak and contaminate the abdominal cavity, so that would lead to peritonitis. All right, so let's look at the gastrointestinal system. It's responsible for the digestive process or the process of digestion. Digestion begins in the mouth, so the food is broken down in the mouth via chewing, call that mastication. Then it passes down the esophagus and goes into the stomach where chemicals or enzymes act on it and break it down to a semi-liquid state. Then it enters the small intestine, large intestine. Right? So digestion begins when the food is chewed, saliva breaks down the food is swallowed, the food travels to the stomach. The stomach is the main digestive organ. All right. The liver assists in digestion, and the liver has multiple functions. So it produces bile, which is necessary to break down fats. It assists in how the body metabolize carbohydrates. It detoxifies drugs. It helps to break down dead blood cells. It stores minerals and vitamins. So the liver has multiple functions. The liver is the biochemist of the body. The gallbladder is a reservoir for bile. So the liver secretes bile, the gallbladder stores it. Now, the small intestine consists of the duodenum, the jejunum, and ileum. So within the duodenum, digestive juices from the pancreas and the liver will mix. The pancreas releases amylase, bicarbonate, and insulin. Right? So the pancreas aids in the digestive process and helps to neutralize certain acids. The jejunum absorbs digestive products and does most of the work. Then you have the ileum, which absorbs nutrients that were not absorbed earlier. It absorbs bile acids so that they can be returned to the liver for future use, and vitamin B12 for making nerve cells and red blood cells. So in a nutshell, the small intestine is where majority of the water and nutrients will be absorbed from whatever we consume, right? All of the nutrients and water will be absorbed as it passes through the small intestine. In the large intestine or colon, whatever fluid remains is absorbed at that point, and if bacteria, the bacteria is broken down at this point as well. So the colon or large intestine, food that is not broken down comes here. Peristalsis moves waste through the intestines, right? Any water that remains is absorbed, and whatever is left becomes the stool. The spleen is located in the abdomen. It has no digestive function. It's a part of the lymphatic system. It assists in filtering blood, and it develops red blood cells. And it has a storage of blood, or a reservoir of blood that is stored in case we go into shock, and it produces antibodies. So that's the gastrointestinal system. Let's look at the genital system. So the male reproductive system consists of the testicles, epididymis, vasa differentia, seminal vesicles, prostate gland, and the penis. Right? The testes is known as the testicles. These are the male gonads. It is behind the penis in a pouch of skin called the scrotum. The testes or testicles is responsible for producing hormones and sperms that are important to the reproductive process and the development of reproductive organs. The epididymis is a coiled tube that stores sperms, or stores sperm and transport it from the testes. The vasa differentia is a duct that conveys sperm from the testicle to the urethra. The The seminal vesicles, which is also called vesicular glands or seminal glands, is a pair of coiled tubular glands found behind the urinary bladder. They secrete fluid that is partly composed of semen. Right? The penis is the male sex organ. What have I not touched on? Think I've touched. Oh, the prostate gland. Prostate gland is found directly below the bladder and above the pelvic floor. The prostate produces fluids that will join with sperm cells from the testicles and fluid from other glands that make up semen. So in a nutshell, all of these structures that are up to the male reproductive system is involved, whether directly or indirectly, with the development of the reproductive organs and the reproductive process. Excuse me. All right, the female reproductive system, you have the ovaries, which are the primary female reproductive organs, also produce certain hormones, protect the eggs that a female is born with, and release these eggs that may go through the process of fertilization. So the eggs are released, they travel down the fallopian tube and implant in the uterus if they are fertilized by sperm. If they are not, then it will break down and that becomes the menstrual cycle. The cervix is that passageway between the uterus and the vagina. The vagina is the outer portion of the female reproductive organ. And we'll leave it at that for now. We will go more into the female reproductive system when we look at obstetric emergencies. All right, the urinary system controls discharge of waste materials filtered from blood by the kidneys. There are two kidneys, one on each side of the body, and the kidneys would be retroperitoneal, right? So they lie on the posterior wall of the abdomen. They regulate acidity and blood pressure, and it rid the body of toxic waste. The blood flow is very high in the kidneys. So in other words, the kidney is the toilet, right? And toilet need water. So the kidneys are responsible primarily for filtering waste from the blood. And we need water in the body to do that. If we don't have a lot of water in the body, the toilet can't flush, right? So that's the kidneys. The ureters join each kidney to the bladder. The bladder is located behind the pubic symphysis. Everybody can hear me? I lost my connection there for a bit.
Hearing you now, sir.
Okay, you know.
All right, good. All right, so we have reviewed the anatomy and physiology. Let's look at the pathophysiology. The abdominal cavity is lined by the peritoneum, also covers abdominal organs, and it has two layers. You have the parietal peritoneum, which lines the abdominal cavity itself, the wall of the abdominal cavity. And you have the visceral peritoneum that lines the organ itself. Foreign materials such as blood, pus, or bile can irritate the peritoneum. If that occurs, then we get peritonitis or inflammation at the peritoneum. Once you have inflammation, you get swelling and you get leakage of fluid. You get leakage of fluid. Acute abdomen refers to sudden onset of abdominal pain, often associated with severe progressive problems. All right, so let's look at these issues individually now. So you have peritonitis, which is inflammation of the peritoneum, right? Typically leads to ileus. Ileus is paralysis of muscular contraction, right? When this occurs, we can have retained gas and feces. This can lead to distension. And when something wrong in the intestine is either where we get vomiting, where we get diarrhea, or we get an obstruction. And if bleeding is occurring, we can get hypovolemic shock. All right, diverticulitis. All right, so this is inflammation of small pockets at weak areas in the muscle walls, usually large intestine. So a diverticulum is a weak area in the wall of the intestine, right? When we have multiple weak areas or pockets, it is referred to as diverticulosis. Now, what happens when the food that is digested is passing through that area, right? Remember, when it goes into the large intestine, whatever water remains is absorbed and stool start to form. What can happen is portions of the stool can get trapped in the pockets, and this can lead to inflammation, right? Now, when that occurs, that is what they call diverticulitis. It's common in persons who have bad eating habits, don't have a lot of fiber in their diet. Cholecystitis is inflammation of the gallbladder, and this usually, one of the common causes of that is something, gallstones is blocking the duct that is leaving the gallbladder, and that can cause a backup inflammation to occur. Once the gallbladder becomes inflamed, it's cholecystitis. All right, abdominal pain. You have two types of nerves supplied to the peritoneum. You have the parietal peritoneum supply the same nerves that supply the skin of the abdomen, right? And this includes perceived pain, touch, pressure, heat, cold. Then you have the visceral peritoneum supplied by autonomic nervous system, right? So the visceral is the one that directly attached to the organ. So where is pain to the organs within the intestine, you can get referred pain in other areas of the body because it's the nerves innovate with the nerves from the autonomic nervous system. Now, causes of acute abdomen. Ulcers. This is where the protective layer of mucus erodes, allowing acid to eat into the organ. It may lead to gastric bleeding. Some will heal without any intervention. Right? So the mucus layer is removed because of the acid. All right, gallstones. This is incomplete. This is when digestive fluids within the gallbladder harden, right? That's what we call gallstones. So the gall stores digestive juice and waste from the liver. Gallstones may form and block its outlet. This can lead to pain and it can lead to cholecystitis, right? So it is when they as I said, the digestive fluids that are within the within the gallbladder harden. Can be because the person there's too much cholesterol. It can be because there's too much bilirubin, and bilirubin is necessary to break down red blood cells. Or it can be that there is something obstructing the flow of the bile. Pancreatitis is inflammation of the pancreas. It is caused by obstructing gallstone, alcohol abuse, or other disease. Signs and symptoms include pain, upper left and right quadrants, nausea, vomiting, abdominal distension. Sepsis can develop. There can also be hemorrhaging. Right. Appendicitis is inflammation or infection in the appendix. So sometimes stool gets trapped in the area and it causes it to become inflamed or infected, right? And patient will present with nausea, vomiting, anorexia, fever, chills, rebound, tenderness. Now, in the early stage, the pain would be more centered around the umbilical region. As it gets more severe, it becomes more localized to the right lower quadrant. And when it becomes severe, the symptoms disappear. So when it ruptures, not the symptoms, the pain disappear, and the patients to show signs of shock. Gastrointestinal hemorrhage, bleeding within the gastrointestinal tract. It may be acute or it may be chronic. Esophagitis, the lining of the esophagus becomes inflamed by infection or acids from the stomach. Pain in swallowing, that's how the patient will present: heartburn, nausea, vomiting, sores in the mouth, right? So basically the food that is moving down to the stomach is back up into the esophagus and causing issues there. Esophageal varices, this is the capillary network in the esophagus starts to leak. The patient will present with fatigue, weight loss, jaundice, anorexia, edema, abdominal pain. So with an esophageal varice, there is increased pressure in the blood vessels within that area. So the smaller blood vessels start to leak, and that can cause a problem. Then you have Mallory-Weiss syndrome. This is where the junction between the esophagus and the stomach tears. This can be a serious complication, right? Principal symptom is going to be vomiting. Then you have gastroenteritis, infection from bacterial or right. My connection just went and came back. I hope you guys are hearing me okay still. We already spoke about the diverticulitis. Fecal matter becomes caught in the colon walls, causing inflammation and infection. Patient will present with fever, malaise, body aches, chills, hemorrhoids. Hemorrhoids are created by swelling or inflammation of blood vessels around the rectal or rectum area, right? One of the signs and symptoms we look for is bright red blood in the feces. All right, the urinary system. Cystitis is a bladder infection, which is common. Also called urinary tract infection, caused by bacterial infection, becomes serious if the infection spreads to the kidneys. Reports of urgency and frequency of urination. Look out for that with these patients. All right, kidneys play a major role in maintaining balance or homeostasis. It eliminates waste from the blood. When the kidneys fail, uremia results, waste product urea remains in the blood. Right? So if something is wrong with the kidneys, it's not able to remove the waste properly. So we start to get waste products remaining in the blood, and this can cause complication for the kidneys. Kidney stones can also grow over time and cause blockage. So this is when the minerals or the urea that remains crystallized and they start to stick together and form what we would call kidney stones. Can be small, they can be large, and they can block tubes and cause complications. Now, acute kidney failure. Yes, Ms. Nesbitt.
Sir, the kidney stones is in the urethra. You said that they develop, sir?
No, I didn't say that.
Where do they develop, you say?
I can't tell you specifically where they develop. It's caused when the urine becomes stationary. Right? So I can't tell you specifically where in the urinary tract it's going to develop, but it occurs when the urine becomes stationary and we have a built up of the mineral and the urea crystals that start to clump together. Acute kidney failure, sudden decrease in kidney function, reversible with prompt diagnosis and treatment. Chronic kidney failure. And when we start to look at kidney failure, is either there is an issue with blood flow to the kidneys, either more than one area of the kidney is not working properly, or there is an issue with removing fluid, urine from the kidney. So either something is wrong with the blood flow, either more than one area of the kidney is not functioning effectively, or there's an issue with removing urine. So chronic kidney failure, irreversible, progressive, develops over months or years. Eventually dialysis or transplant is required. All right, female reproductive organs, gynecologic problems are a common cause of acute abdominal pain. The lower quadrant pain may relate to ovaries, fallopian tubes, or the uterus. Other organ system. The aorta lies immediately behind the peritoneum. If there's a weak area in the abdominal aorta, they can develop what's called an abdominal aortic aneurysm. Right? Pneumonia can cause ileus and abdominal pain. All right, now hernias. Hernias can occur as a result of, so this is a weak area in the lining of the peritoneum. So there is a weak point or an opening, and the abdominal organs can protrude through that opening, right? So protrusion of an organ or tissue through an opening into a body cavity where it does not belong. It may not always produce noticeable mass or lump. Strangulation is a serious medical emergency. So this is where the organ, parts of the organ protrude, or parts or tissue protrude, and the opening is so narrow that it starts to compress the blood vessels that supply that particular area, organ, or tissue. And this can cause the cells to die in the area. Serious hernia signs and symptoms include formerly reducible mass that is no longer reducible. So sometimes they can have what is called a reducible hernia, and this is basically a hernia in which you can push back the structure through the opening. If they are not able to push it back through the opening, then we have a problem, or it can become a problem. Pain at the hernia site, tenderness when the hernia is palpated, red or blue discoloration. All right, so that's the pathophysiology. It's a lot to absorb. Remember, in the field, we're not going to be too focused on trying to figure out exactly what is causing the issue for the patient, because you just might not be able to do that. But you should be able to recognize that, hey, this patient might be having a life-threatening issue, and act accordingly, right? But unfortunately, for exam purposes, some of these itis you will be required to remember. All right, so let's look at the patient assessment. Scene size up, ensure that your scene is safe. Consider wearing a gown and disposable protective covers for shoes. We will consider the mechanism of injury or nature of illness, maybe the result of violence, so it may be a trauma situation. Pale and sweaty patients with tearing pain, you need to be thinking about a AAA, right? Look out for unusual odors, look out for gastrointestinal bleeding. All right, and once we have completed our scene size up, the next phase is the primary assessment. This is where we will manage immediate and potential life threats. So focus on your airway and breathing. Abdominal pain may cause shallow, inadequate respirations, right? For circulation, ask about blood in vomit or black tarry stools. Check pulse in both arms. Transport decision, right? Immediate transport is needed if there are signs of significant illness. All right, after we've completed the primary assessment, the next phase is history taking. So we will obtain a sample history, things that we need to think about: nausea and vomiting, changes in bowel habits and urination, weight loss, belching or flatulence, pain, concurrent chest pain, or other signs and symptoms. Right, in your physical examination, you expose the abdomen, you observe the abdomen for palpitation or pulsations. Sorry, pulsations, not palpitation. You observe the abdomen for pulsation. If you see pulsation in the abdomen, do not palpate it, right? If the patient is complaining of pain in a particular quadrant, you start in an area where there is no pain, right? And you always compare right to left, right? Always compare. All right, in your secondary, Vital signs, check respiratory rate, pulse rate. Reassessment. Frequent reassessment is important. Assess interventions, including treatment for shock and emotional support. Transport the patient in the most comfortable position. And if they're responsive, they usually will want or have their legs bent to ease pressure off the abdomen, or what we would call the fetal position. All right, so let's look specifically at medical care now, emergency medical care. Cannot treat causes of acute abdomen. Take steps to provide comfort and lessen effects of shock. Treat for shock even when obvious signs are not apparent. Low flow oxygen may decrease nausea and anxiety. After releasing the patient to hospital, staff clean the ambulance, the equipment, and your hands. All right, dialysis emergencies. Dialysis is the only definitive treatment for chronic kidney failure. Dialysis filters blood, cleans it of toxins, and returns it to the body. If the patient misses dialysis treatment, they can develop pulmonary edema. That would definitely compromise the respiratory system. Some services transport patients to and from dialysis centers. The dialysis machine functions much like the normal kidneys. So adverse effects of dialysis would include low blood pressure, muscle cramps, nausea and vomiting, hemorrhage at the access site, and they can develop infection as well at the access site. All right, your emergency care for dialysis emergencies should be centered around maintaining ABCs, airway, breathing, circulation. Provide high flow oxygen if indicated. Manage bleeding from the access site position. Sitting up in case of pulmonary edema, supine in patient if the patient is showing signs of shock, and we transport promptly. That's it. Right? So that's gastrointestinal and urologic emergencies. A lot of itis. Yes, Miss Nesbitt.
Sir, a dialysis patient, some of them have a fistula on their hand and we're taking the vital signs. We can't put the blood pressure machine on the hand with the fistula.
Right, that's correct. So if they have a fistula or they have a lump in that arm, we don't do the blood pressure on that side. So that's correct. All right, so that's chapter 18. Let me stop this.